if you don't have a target, you don't have a place to go, a map is useless because, okay, like what am I going to do with this?
It's a map, yeah.
But at the same time, if you have a place to go and you don't have a map, you can start creating a map by making movement. So it'll take you longer than if you had a map, but just by having a place that you're trying to get to, you can start defining a map for yourself in some ways.
Hey, what's up, guys? I am coming to you actually on Black Friday, which is the day after Thanksgiving. And I just want to say thanks for making it this far into the show. If you've been listening to any of my podcasts or episodes and you've been enjoying them, or even if you haven't been enjoying them, I appreciate you. I appreciate you for listening. I'm learning a ton. I'm personally getting a lot out of the process, and it's been exciting. So with anything new that you take on, I have been learning, one of my values is to fail often. And I've certainly had some failures with the podcast. Today, the one that you're going to listen to, there was operator error. I forgot to hit record at the beginning of this conversation, and then the space on my phone kind of cuts out at the end. So I'm just here to ask you to bear with me on this one. The sound might be a little off in the very beginning because we're going to have to use the camera sound, and then there's not going to be video towards the end, and there'll be only sound. But this conversation was awesome. I think it's totally worth still putting it out there, and I hope you get a lot out of it. And thanks again for bearing with me. So at the beginning, you missed the introduction of Dr. Zain Hakeem. He's a medical practitioner. He has a doctor's office here in Austin, Texas, and I just love his model of medicine. He runs it's a concierge medical practice, but general practice. But the way that he approaches it, he comes from a goal approach. He tries to take the person's what they're trying to achieve in their life and what their strengths are, and then he takes their physical health, their medical health, and works it into their goals. And so it's a unique approach. He's definitely a pioneer, and I think you guys are gonna love this episode. So without further ado, here it is. So I'm so excited to have this conversation with you. Yeah. Like we were just talking about a couple minutes ago, you and I have had at least 4 conversations in the past where I walked away thinking, man, that was such a good conversation. And I wish I had captured that. And your approach to work and your approach to medicine and just the way your brain works is just fascinating to me. And I thought the folks, whoever's going to listen to this thing, I thought that they might really enjoy your perspective as well. So thank you so much for taking this time with me.
Cool. Yeah, my pleasure. And likewise, always enjoy our conversations, and always something valuable for me that comes out of it. So yeah.
We'll just start out with is there anything fun and exciting you've been working on lately? We kind of talked about a couple little projects you might be kind of working on, but what's top of mind?
Several. Well, the very top of mind is our fitness app that we've kind of batted around.
Yes. We're going to take a look at that here in a little while.
Yeah. And as I've been working on it, I think just it plays into a bigger thing for me that is being able to quantify and being able to project long-term goals into the short term and say, oh, I want to be healthy in my 90s. Okay, that's a great goal. How will you know if you're on track? Are you going to find out when you're 90? Because that's a yes or no to that question, but it's not helpful in the short term, right? So I think the app just kind of reinforces that idea of bringing long-term goals into what am I going to do today?
Yeah, and I love that you're thinking about that as a medical practitioner, because just the fact of wanting to have your patients and the people around you be healthy, down the road, and I'm a big firm believer that habits, what you do on a daily basis is basically going to predict how you end up 10, 20, 30 years down the road. But I don't feel like enough
at least the doctors that I've been treated by, and the ones I hear, anecdotally about and stuff, really spend a lot of time really helping their patients and stuff work on that. So I love that you at least think about it.
Yeah, I think there's a lot to that. We have a system of medicine now that captures physicians. One of my mentors in med school, Walter Whitriell, was an amazing doctor in his own right. He kind of told me, he was like, look, the medical school, residency, all of this training is the status quo. So you have to learn that, but you have to think about the fact that on the other end, do you want to just keep doing the status quo, or do you want to keep building, right? And you need to think about that now. He had a very sobering sort of outlook on it, which was, he said, look, if you think about the way med school is run, and of necessity, he wasn't knocking it necessarily, but he says all the elements that cults use to indoctrinate members are present in med school. Sleep deprivation, in-group jargon, language that no one understands, separation from friends and family, a culture of superiority and elitism, access to special knowledge, right?
Wow. I never really thought about it, but it's true.
Yeah. And he said, and no cult in the world takes 7 years minimum to do the indoctrination. You are in this for a period of time that is unreasonable. If you're going to come out at the other end as a free-thinking individual, you need to be very conscious about how you're going through this.
Right. You have to go into it with that in mind.
Yep.
Yeah, because it takes a lot of courage and a lot of, strength to kind of be the one person standing out there alone, or being the one
or just obstinacy, but yeah.
Right. Yeah. Well, it's that whole thing about the high degree of high level of disagreeability. Well, that's awesome, and that you even had a mentor in medical school, kind of like talking to you about those kinds of things.
Yeah, I mean, he introduced me to several books that kind of like opened my view of just alternate ways of thinking. One is called Cells, Gels, and the Engines of Life, which is a biochemistry textbook at the end of the day, but it literally presents an alternate explanation for all the biochemistry we learn in med school and pre-med, right? Mm-hmm. So it's like, hey, you learn all these things. Here's another way that could all be happening, right?
Interesting.
And it's like, whoa, okay, all the stuff we learned is not the only possible explanation.
Right, they're theories. Yeah,
right.
And there's some evidence behind them. When I was in school for exercise science, so a little different, but I remember my professor saying, this is the sliding filament theory, and it's a theory because this is how we think it happens, but we're not really sure, and that was in my mind. I was like, okay, we haven't figured this all out yet.
Yeah. I mean, it's very confusing, and one of my favorite, there's a comic, XKCD.
Yes.
Yeah. And so one of my favorites on there is, he's look at Google's code, right? This is our smartest engineers on the planet optimizing code for several decades now, right? Evolution is the harshest optimization pattern you can run, and it's been running for 4 billion years, right?
Right.
So things that happen in the body, nothing ever does one thing. Nothing is linear, almost.
Right.
Everything is doing actually multiple different things. And to understand that is you've got to weave through layers and layers and layers. And so that kind of loops back around to the way I try to run the practice, which is instead of trying to understand the micro thing, like, oh, I can affect this receptor with this chemical or this drug, which is fine. But if you can pull sort of the bigger levers, say, hey, we're built to do better if we experience periods of stress and relaxation rather than low-level chronic stress, right? So acute sprints and workouts, you're going to do better than trying to jog, 40 miles.
Right, because that's not how we evolved.
Exactly.
Yeah.
And fasting, similar things, hey, we seem to have certain circuits that are triggered biochemically when we fast. That's just a lever. Now, you can get into the details of all the chemistry of what's happening there and say, okay, maybe we can design a drug to do some of those things. But or you could just fast, right?
Right. Just do it how it's been done. And that, same thing is that people ask me all the time, like, should I fast? How long do I fast? And I'm like, well, obviously our ancestors are a good way to look back. Like, these are real things that they had to deal with. And they certainly had fewer of the chronic diseases that we had. They had some others probably, but so I love that, again, a doctor is kind of looking at that and trying to prescribe some of those things to some of their patients.
And it gets into really interesting stuff. So like one bits of data that we know, but don't really know what to do with, right? Intimate relationships and community decreases your chance of death, mortality, heart disease. We know that. It's actually pretty strong.
Right.
It's one of the strong, I think Dean Ornish, in some of his later books, said it's a stronger factor than almost anything else you can do. Okay, that's great. We know married men live long, right? But what do you do? Like, what? Okay, I'm not married.
Right.
What am I just gonna do?
Yeah, damn. Yeah, I was like, I just gotta find someone, because it's not, is it? And it's not just well, maybe it is. Like, do you think it's literally just having a partner, someone to share life with, or is it more like having a healthy relationship, or are there distinctions?
No, there is distinction there. Yeah, I think, and the more nuanced you get in any scientific endeavor, the fuzzier the data gets, because you have more factors now that you're looking at, right?
Right.
So stability seems to be part of it. So that to that degree, it's almost any partner will do, right? The other thing that seems to be a part of it is the degree to which you are vulnerable with the other person. Right?
Interesting.
And so there's a support aspect, which is just hey, there's some other person who is risk tied to me, so that we are mitigating and sort of creating risk pooling between the two of us. And that doesn't, whoever's willing to make the commitment.
Right. A warm body.
Yeah, exactly. But the other factor, there does seem to be the emotional component of vulnerability and saying, okay, this person really knows me.
Yeah, that's fascinating. That part is fascinating to me because, again, not being a doctor or a scientist who studies anything like that, I can say that how I experience some people who seem to be a little less vulnerable, who seem to be bottled up their stress, who don't seem to have great pathways for getting some of that out, tend to me like they tend to have more health issues. They tend to be sick more often. They tend to not be as resilient, physically. They tend to have more injuries.
Yeah.
And I've seen that over and over again. And I can kind of sometimes, now having been a coach for as long as I have, I can kind of see them coming from a mile away. You kind of tell who's going to have some of those issues versus other people. So,
and you got to wonder how much, just where my brain goes with is, you wonder how much of it is also coming out in things like over-competitiveness, not knowing your limits. Well, maybe I don't know my limits because I'm stressed and I'm trying to work out that stress in some physical way rather than paying attention to my body saying, hey, that's enough.
Yeah, or even just the fact that I haven't allowed myself to express my limit. I haven't bounced my limits off of others enough to kind of to know where those limits are, and so that could be part of it too. Maybe.
Yeah, well, Jordan Peterson talks about this a little bit, and he says, we used to, or maybe a lot of us still do, we think of our sanity as something internal. It's like, hey, my mind is well formed, it is well structured in some way. But as social creatures, we outsource large parts of our sanity.
Oh, without a doubt, yeah.
And it's like, well, if you don't see the guy in the corner, then maybe I'm gonna not talk about the guy in the corner, and to some degree stop seeing the guy in the corner. And it's interesting the degree to which our perceptions are governed by our social interaction. So, there's too much data even in just this room. Like, we could talk about the grain of the weave of the carpet, whatever, or some, but we don't, right? And the reason I don't even perceive that until I call your attention to it is because we never talk about it.
Right.
So we don't see it.
Yeah, it's just not there at all.
Yeah. If it's not something that we might talk about, our brains don't see it. We just don't perceive and so the social impulse is at the core of everything we see, everything we perceive. And then if you don't perceive it, how can you act on it?
Right. And so it's, yes, and it's always those brave souls, those people who are willing to call out the man standing in the corner, and say, hey, do you not see the guy in the corner, or do you not see the weave in the carpet? Can we talk about that? And to kind of have a broader, like you said, to be more sane,
I will say, funny story. One of my med school classmates is hilarious and actually just texted me a little while ago, John Abraham. we were doing our psych rotation together, and the habit in med school is, big gathering. There's the senior resident, and then the junior, and then the intern, and then the lovely med students, right? And so the attending will ask a question like, okay, this patient's complaining of seeing, monsters in the room. What is a possible explanation? And the first one, this could be schizophrenia and schizoaffective, and by the time it gets to you, all obvious ones have been taken, right? You're the third year med student or whatever, and he just goes, monsters.
it's
maybe there's monsters there. And you consider that he's just telling the truth. There's brilliance in that idea, right? But he's hilarious as well. But there's also that idea. Well, and I've certainly taken that to heart in my practice. I've had patients come into the hospital who seem very off, crazy, right? They'll tell me some story that seems wild, but I always try to verify, it's just true, because wild stuff happens.
Right. It's important to start with, let's just find the facts.
Yep.
And if this guy's saying something, for me, it's better to, just even as a tactic of problem solving in any kind of thing, it's better for me to start to rule things. It's easier to start to rule things out.
Sure.
There are some things that we know or think we know or could be known. Start there. And,
sure.
Not up here. I was a social worker, and I had to work with a lot of folks who, I worked with people with severe and persistent mental illnesses. And that's a hard field because, like you said, sometimes they were telling it was real.
Truth.
Yeah.
And that's the worst part.
When you're already dealing with your mental health and people are already treating you like you're crazy and unreliable, that just deepens you into your illness. And so,
yeah, for sure.
So I developed a practice of just kind of okay, let's act as if this is true and then eliminate it if we have to.
Yeah. And just, I don't know, seeing somebody's humanity and saying, okay, sounds wild to me, but the key part of that is to me. And let's see if we can find common ground, if we can find something we agree on or whatever. And I don't know, being able to find those pathways into exploring truth.
Right. That kind of is a good segue for me, because one of the things that I've been curious about, and I'm always interested in why people do what they do. You know what I mean? What led this person to follow this path and spend that amount of time and that amount of money doing what they do? And so what got you into medicine? What is it that brought you? Because you were in software or something before that, or?
Yeah, so that started as a summer job. That was what paid the best.
Yeah.
So, but I got into it and considered it for a while. And I was in high school. I was pure math. Physics. I thought I was going into pure mathematics or theoretical physics. That was my jam. And there were a lot of other influences. My mom's a physical therapist, and taught me a lot of things about manual therapy, about relaxing muscles and doing that kind of stuff. And so a lot of the osteopathic craniosacral work I do, is extensions of what she had taught me, and some of it was just kind of keeping kids quiet kind of stuff. She would, give me a quarter and say, okay, put it in your pocket, and by feel, I want you to tell me which side is heads and which side is tails, right? Just developing that sense of touch, right?
That's awesome.
And also, as I'm occupied.
Time consuming.
Yeah. And so, developing those skills, so that's part of it. My dad's dad, my grandfather in Pakistan, was sort of the top physician in that province. So huge square mile radius, and basically the only real physician, and real cowboy medicine back then, right? There's no there's no one else, right?
Right.
And so he did operations on hotel dining tables, like cutting tumors out, just like here's the scalpels. Tell the staff to go boil them. And
can you imagine just having to be him and this is on me. This is for me to take ownership of, and I'm going to do the best I can. And maybe I know what I'm doing, and maybe I don't. But I'm the
doing
last.
Both the anesthesia and the surgery.
Wow.
With ether.
Wow.
It's crazy stuff, right? And fuck yeah. I mean, the other thing that was always told about him, and that my family, I think, without meaning to be arrogant, but like sees in me a little bit, I think, and did from a young age, was he had a knack for sort of knowing what the diagnosis was, and could explain it afterward, maybe. Like, okay, we'll get the tests and we'll figure it out, but this is what you have.
Right. Yeah, I know.
And it's just like that kind of thing, a certain intuitive sense of it.
Yeah, I think some people are born healers. And they just somehow, I have my theories about how we know things that we know or whatever, sure. But I totally believe that there's people with that type of intuition,
Yeah, and he had it from all the stories that kind of have come down from that time. And so that was an influence. And then I think the other big one for me was I did philosophy in undergrad. So I was going pure math, science, physics, like hardcore, technical stuff. And I took an intro to philosophy course and fell in love with philosophy. And I kind of realized that I wanted something out of the ivory tower. And medicine, I think it's interesting because people talk about medicine like there's a lot to learn, and there is a fair bit to learn. A lot of it's just rote memorization, unfortunately, and there's just a certain amount of like slogging through piles of data. But the real challenge of medicine is making judgments under uncertainty.
Right.
Is I don't have all the information. Like, I admitted someone a couple of days ago to the hospital, like found down in the street, homeless. They are unconscious when they come in. Like all your med school training is like, well, ask the patient how long the symptoms were. No, the patient's unconscious.
Yeah, unconscious. Yeah.
Well, how old is the patient? Nobody knows. No ID, right? And so how to make judgments under level. And then, then you have other patients who will give you happily. And, I had another patient the same day who weird rash, constellation of joint pains and symptoms and whatever. And we talked to her for like an hour and a half. And she gave me great history on trying to put the pieces together, right? But still there's a lot of possible explanations. So again, the uncertainty and that to me was kind of like applied ethics.
Right.
It's fine to talk about ethics or bioethics in the ivory tower, but doing it and being there and making those decisions, hey, should I recommend that the family give up on this patient? Should I say, hey, should I remind them that hospice is an option? Does she want dialysis?
Right, try to instill undying hope. What do you do? Yeah, what do you do? Yeah.
And how, I put central lines in the ICU, big IV in the neck, has a certain complication rate as any medical procedure does. And we have to get informed consent from the patient or the family. Well, the way I talk about those risks, I can guarantee a signature or a non-signature.
Right. Yeah. I know what the words to say.
Yeah.
And yeah.
I mean,
or not say.
And I can say the same words, just in different tones.
Mm-hmm.
And yeah, I can say the family. I can get the family to be like, no, it's too much risk. I don't think whatever. Or I can get the family to be like, sure, doctor. And what are the ethics of that? When you can slant the informed consent with the same words just by tone, that's not governed anymore, right?
Right. Yeah, and I mean, and then it goes back to, why am I doing? Our ego can get caught up into what we're doing and why you might want to get someone to do something or not do something.
You can get really questionable with it on ethical dilemmas.
For funsies.
Yeah, for funsies. We definitely had patients in residency where, did they really need it? I probably wouldn't put it in now if they were my patient now. But I needed the training.
Right.
Well,
so that you could do it later.
So I could do it later. So all the people that I've helped years later have benefited, But that was a questionable call, that was maybe more risk than that patient needed individually. But then in the bigger picture, I'm one of the very few internists who practice in the hospital who does his own procedures and doesn't have to call a specialist and doesn't, who may not be available. And so I can work in border towns and I can work in underserved areas because I can do all these things.
You got the reps in, so you know how to do it.
Yeah. And so then there's the ethics of like, okay, well, how do those things? Anyway, so that's how I got from philosophy into kind of medicine. And I've always, looking all the way back around, I've always had a fairly philosophical view of like, what should we be trying to do? What should medicine be about? Right? It's easy and modern medicine largely is about, patching holes, just band-aids.
Just treating symptoms.
Yeah. And I felt like we could do better. And I think in my third year of med school, again, I went to osteopathic med school. That was, I had my choice. But the osteopathic philosophy kind of resonated with me. The core principles are the natural state of the body is health. Mind, body, and spirit operate as a single unit. And function and structure are intimately interrelated.
Mm-hmm.
And rational treatment proceeds from those first three principles, right? And that always made sense to me. I think that kind of resonated with my view. And the founder of osteopathy had a saying that he said that it is the role of the physician to find health. Any idiot can find disease. And there's an interesting thing there is like, what are we doing in medicine to find health in people? We label diseases and then we treat those diseases, but we're not actively encouraging health. And that kind of comes back to fitness. It's like, well, that's definitely an area where you can build up. It's not just about preventing breakdown.
Right. Yeah. I'm so glad that you said that because it's really how I ended up in, owning a gym and everything else was like, as a social worker and that's what I was doing. I was treating, I was just patching Band-Aid. I was patching holes, giving people Band-Aids, treating symptoms, and again, working in a field that really wanted to just diagnose everybody with something. Like it kind of, the system wanted you to be ill so we could put a label on you and potentially, if you were in a nonprofit or whatever that would benefit from you having said label, we wanted you to have that so we could exist ourselves. And it just was endlessly frustrating for me to and I wanted to be a part of, like you said, the solution. It was something that felt like it was keeping people out of those places and having fewer labels. So I love that you approach your practice like that. And just from the conversations you and I have had, your practice is a little bit different here. And so like, what's your elevator speech on how you describe your
so for me, it is exactly this is I think medical practice should be about building up, not patching holes. If you're going to build up, you have to have a target to build towards. And so I try to start with figuring out what people's dreams are. What do you want out of your life? What is your definition of success? And a lot of people don't know. I had a really phenomenal conversation with a patient who just joined who had a clear vision of what his definition of success was. He'd been very successful in his career. He came in and we started talking. And when we started fleshing it out, he very quickly came to realize that, or knew already, came to tell me that success in his relationship, in his family, was his new mode. He's like, I've already had all the career success that I want. Now it's about relationships and family and making the people who are closest to me feel loved. And that was amazing. And so we start, I'll do the whatever fitness testing. And it's not that he's not interested in those things, but by far his definition of success was that. And so the fitness is actually in service of those relationships.
Right. As it should be.
Yeah. It's hey, okay, you want to be around long enough to continue doing that and making those people feel loved, okay, you got to keep yourself in some good shape. You don't want to be a burden on them. All those things play in. But now he has a reason every time he goes to the gym. It's tied to his purpose. It's okay, hey, this is so that when I'm 90, I'm not a burden on my kids. That's motivation. That's
Yeah.
So I've gotten off the elevator speech.
Well, no, but I'll come back to that.
Yeah.
Go.
Anyway, so the elevator. So without the tangent, is number one, picking dreams, finding what the obstacles are to overcoming those dreams, and then creating a quick feedback loop to make progress toward overcoming those obstacles. And that's how I run my practice.
And do the people who come to you usually are they coming to you because they're having some sort of symptoms that they want treated, or is it generally someone who's just looking to have a new doctor, kind of just for general health stuff?
Yeah, usually I've had one person come to me just wanted general health stuff, I think. Usually most people know they want general health stuff, but that is not sufficiently motivating to actually get them in the door. And then something happens and they say, oh, I wish I had a doctor who knew me and was taking care of me and kind of knew all my history. And now I'll go out and try and get that. And so almost inevitably in the first few interviews, there is a problem.
Right.
And then you have to work through that problem. And I think that's one of the hard parts is all my training is dealing with problems. And it's easy for me to fall back into the way I was taught and say, okay, well, we'll just deal with the problems and we'll kind of focus on those and we'll try and work the problem. And to not do the thing where it's like, well, let's forget about the problems for a second.
Right. Let's come from a strength-based approach.
Yeah.
With all the things that are going well, what do you want this to be in service of?
Yep.
Yeah.
Yep.
And it's funny because I have the same struggle as a coach or as a trainer. Someone will come. Why they come to me is often, not always, but somewhat flawed. It's it's maybe they're they don't have great self-esteem and they want to look better, or they live in comparison.
Talk about it. If you're single, you got to find somebody.
Yeah. Yeah.
That's deep purpose right there.
Right, I know, but that's true. That is true, and that is part of it. But it's like sometimes people come to me or to our gym with their end state being in a high level of fitness. Like that's their goal. And that's just kind of a life of misery. One, it's somewhat fleeting. How do you even define it? Is it even possible for, your version of elite fitness? Is your body, is your mechanism and your organism even capable of that? And it just seems to me like that your health and your fitness should really be contributing to a bigger purpose.
I'm right there with you. Yeah, I think one of the things I've written about, and it's on the website as well, in terms of the practice, is health is, to me, the best analogy is something like money, right? If you're just making money to make money, there's a little bit of emptiness to that. Money, in some sense, should be there to do something, even if it's just creating experiences that you love, or it's a means, right? And so if you have a means without an end, that's kind of silly, right? And the same thing is true of health.
Imagine, you live a really healthy life by yourself and you live to 150 but contribute nothing. Okay, I mean, if you're a particularly happy and optimistic purpose, maybe you find that okay. But I think most people needed some sort of meaning more than that they loved someone, they touched someone, they improved something. And the health was to allow them to keep doing that.
Right. Do you, not to get too philosophical, even though I know it's kind of your background, but like, do you think that there's an actual, or do all of us have a purpose, or is there a reason why we're all here? Or
I tend to be pretty staunchly in a free will kind of category on most things. So I think that we all need a purpose, But I think that purpose is something that we create and put out into the world, not something that is pushed onto us. With that said, I think that we also have, personalities that are not fully under our control, and gifts that, genetically or from our parents or whatever, that are not something we chose. And there are things that stand out into the world as being more interesting or important than other things. And in defining our own purpose, I think we need to pay attention to what stands out from our unconscious,
Right. That's kind of my thought on it. I don't think that we all have a predetermined purpose. Like,
Sure.
you were born to do this thing. I mean, that's kind of evidenced by a lot of people who don't accomplish anything in their lives, for whatever reasons. And so I do believe that we get to choose our, we get to choose our purpose, and we are here to, that's part of, why I think we're here. We're here to pick it and to contribute in some way, but not to have it like assigned to you.
Yeah, no, I think that's true. I think, meaning is one of those weird things where, as you define it into the world, you create the map of the world that you see. Kind of, we were talking earlier, if you don't have a target, you don't have a place to go, a map is useless, because, okay, like,
right.
What am I going to do with this?
It's a map, yeah.
Right? But at the same time, if you have a place to go and you don't have a map, you can start creating a map by making movement. So it'll take you longer than if you had a map, but just by having a place that you're trying to get to, you can start defining a map for yourself in some ways.
Yeah. Well, it's kind of funny. Like, you and I have had conversations about your business and your practice, and like, you had a vision, you had this end goal, this destination, but there really there's not a map to practice like you do. Right. And so you're writing it as you go, and you may end up, your model may end up being someone else's map.
I hope
down
so.
the road,
I think that's the real dream, is that I'm able to refine this map enough to give it to someone and say, hey, you could do it this way, right? And the practice of medicine as a whole worldwide could be different because now this map has been enriched in some way.
Yeah. So with that, and
or extended.
Yeah. Having said that, that's a goal of yours. Do you, is it your intention to teach down the road, or is it more of like kind of like a business? I'm going to use the word franchise just for something that people know in language, but like, is it more kind of like that, or is it more like, hey, let me be a disruptor in the medical field by teaching? Or
it's actually both. I think that I will have to, I suspect, go the franchise route in order to refine the map enough to where it can be taught. So having a physician come in, trying to teach them what I do, is in itself going to be a learning process.
Right. Yeah. Because I see that a lot, where it's like, you can only capture even so much data in one office with the number of patients. But if you can create satellites of capturing data and different ways of practice and learning with different types of people, not just you, because this is what works for you. Yep. But it may not work for everybody. So you'd have to get some reps in there.
And I think the interesting thing to me, something I think about a fair bit, is the structures that we create in medicine. So one of the great problems that we have nationwide, worldwide, and in medicine and all these different layers is, what is the correct degree of centralization for a problem? Because imagine a fairly centralized version of my practice where I have created this map. This is how I do things. And now you're a franchise, and I'm going to tell you how you have to practice in order to be a franchise of whatever. And it's very sort of draconian, whatever. Well, maybe I can replicate some of the successes, but I also can't grow, because that person can never add value. Right. So, but the degree to which I decentralize and say, okay, well, you can do whatever you want. Well, they could potentially add a lot of value, by creating their own maps, enriching it, all of that, they could also sort of destroy the practice, right? By
just go completely off the rails. Yeah.
So it's an unsolved problem. I don't have an exact answer for that, and I think that's part of the calculation I'm trying to do is, hey, as you start franchising, how do you manage the need for, one of my favorite books is Ender's Game. And he's a sort of commander in a army, and he gets one of the younger kids who's extremely bright. And he sort of creates his own like sort of special ops type team or whatever. And the kid asked me like, why, or Kat asked him like, why did you do this? Like, you're brilliant. You're a brilliant commander. And he says, as brilliant as I am, there's a limit to the number of brilliant ideas I can come up with in a day. I'm creating your team for that day when my idea doesn't work. Right. And it's a really interesting, like, I don't even know when that day is. I don't know what that day is. I just know it's coming where I don't have the answer. And
you want there to be others who will.
Yep. That sort of decentralized, like, hey, okay, I need you to go off and do, and he tells him, he's like, I want you to do things that no one else has done because they were the dumbest thing you've ever heard. Like, start doing stupid shit because somewhere in there is an idea nobody's thought of or was dismissed.
Yeah. And that's kind of the cool thing about, the people who I really look up to and I really admire, they are just ballsy sons of bitches, you know, that they were the crazy person until they weren't crazy anymore, until what the crazy thing they were doing actually made sense and became the normal way. And the thought leaders and then the courageous people who are brave enough to follow that idea and not just let that person be out there, the one person dancing out in the middle of the field, you know?
I wrote my, in residency, I did a dual residency, internal medicine and pediatrics. And our graduation project, we had to give a presentation to all the residents, med, peds, and emergency medicine. And so my research project was, as you might imagine, fairly philosophical, on sort of the limitations of what, I don't know if you've heard the term evidence-based medicine. Yeah. And so was on the limitations of evidence-based medicine. And as I was doing the research for it, I read the story of how we came to surgically treat heart disease as we do it now. So it's fast. If you don't mind me, this is the story.
No, I want to hear it.
It's a fascinating story. So, in the 1900s, kids were born with, or a certain small percentage of kids are born with the pulmonary artery and the aorta transposed. So you're supposed to have a circulation system where your heart pumps to the lungs on the right side, it comes back to the left side, and the left side pumps it to your body, and then it comes back to the right side. So it's sort of a figure of 8 schematically. But instead of a figure of 8, they just have 2 separate loops that don't interact, right? So the blood goes to the lungs and comes back and keeps going to the lungs. And then the blood goes to the body and comes back and keeps going. And as you might imagine, that doesn't work because you're not getting oxygen.
Right, yeah, oxygen's kind of important.
Yep. Now, kids have in their fetal circulation a connection between the 2 sides of their heart. And so there's enough blood mixing just by having a hole there that it allows them to survive for a day or 2 until it closes. And then they have then they die. So there was I believe he was a colonel, actually. If I'm not mistaken, he was an army surgeon, created a procedure where he could go into the heart and force that hole to stay open. And he actually created a little tissue baffle that would preferentially increase the mixing. And that, I believe that was called the mustard procedure. And so these kids went from a life expectancy of 1 day to a life expectancy of about 40 years, right? Which is pretty good.
That's crazy.
Yeah. The issue there,
I was thinking like a couple weeks, it just keeps you alive long enough till we can flip these valves around or something.
Nope. The bodies are remarkably resilient.
Wow.
It's incredible. Right. but they didn't have normal lifespans, right? And the theory was that if we could actually switch the arteries back, we could get these kids to live a normal lifespan instead of dying in their 40s. In order to do that, you had to be able to bypass the heart, and you had to actually operate. You couldn't just go in and like open a hole that was already half there anyway and just kind of keep it open, right? You had to actually operate on the heart and cut the valve or cut the aorta, cut the pulmonary artery, and sew them back on. And people tried for, I think, 70 years.
70?
70.
Wow.
Many surgeons tried over the years, and you needed a heart-lung bypass machine, right? And various versions were tried. They tried like having a chimpanzee do the pumping, so like just hook into their circulatory system, or a pig or whatever, and cross clamp it, and all kinds of things were tried. And the prevailing wisdom was that the heart was too delicate to operate on. It just could not be done. We've tried this for 70 years, and we have a procedure that lengthens the lifespan from a day to 40 years. So every kid that you operate on, you're depriving them of 40 years of life because they're going to die, right? Because your procedure doesn't work.
Right.
And yeah, and then Jatard and his team actually were able to create a heart-lung bypass machine and did the first successful transplant, right? And were able to reverse the arteries. Now, the interesting thing is he started doing this. He had one success after a string of failures. And by the way, these guys, you're talking about doctors, like these guys are fucking hardcore. They scheduled, it still gives me chills. They scheduled the surgeries twice a day so the families could comfort each other. That was the logic.
It was like these guys are probably going to die.
We know that they're going to die, and we're going to schedule them twice a day so that the families can comfort each other. It's stupid, right? And then he had his first success, and then he had his second one. But out of the first 10, his success rate was like 2 out of 10, right? But out of the first 25, it was like 12 out of 25. And out of the first 100, so he's getting better and better at this procedure as he's doing it, right? But if you look at that first 10, 8 out of those 10 kids died. The mustard procedure was well established. They could have all lived to age 40.
Right.
Right. But he just persisted, and all of our heart-lung bypass machines now are based on that set of knowledge. Our ability to do cardiac bypass, grafts for heart disease, our ability to do aortic valve repair. All of our heart surgery is derived out of this guy killing kids. Like,
right. And so, I mean, that's what I'm talking about, the courage to, and of course, like if you're one of the parents of the kids that died, this is a horrific story,
and everybody looking on. We've tried this for 70 years and haven't been able to do it. What the hell are you doing?
Right. You're a savage. You're a mad person.
Yeah.
And so when you wrote your paper about it, what was your argument? Like, what was your basically your position?
So my position is that the problem with evidence-based medicine at its core is that it reinforces the status quo, right? The best that evidence-based medicine can do is to, imagine you have a bell curve of all doctors doing slightly different things. We all have slightly different preferences, styles, whatever. And if everybody, or the more people that adopt evidence-based medicine, the narrower and taller the bell curve will get, right? But that's on both ends. Yes, you have fewer doctors doing wacky things that don't work, but you also have fewer doctors doing wacky things that end up working.
Right.
And the problem is that your outcomes probably look better right now, and from a legal standpoint, a risk standpoint, all of those things, it probably looks better right now. But you're also killing innovation that drives things forward.
Yeah. So what's a way that it can look different? Because I mean, I see why some people lean towards evidence-based stuff. You want to do things that you know works and try to do no harm and things like that. So what would be a counter to that?
So I've talked about this even with colleagues, is I don't think you get to pick which side of the bell curve you on. You only get to pick how far you are from the mean. And that's the unfortunate thing, is that like that guy could have been wrong and just killed kids.
Right. And there probably have been people that we don't talk about
exactly right.
at all who did exactly that.
Yeah. And so that's the unfortunate thing, is that in your lifetime, probably maybe, you don't get to know which side of the average you were on. You only know how far away from average you were. Right.
Right.
And that's how much risk you want to take on, how much legal risk you want to take on, and how much you believe in what you're doing. What I'm doing has no evidence behind it because I'm making it up as I go. This kind of wellness-based, kind of dream-based, goal-based view of health and fitness and medicine. I've never heard of it, the way I do it. And,
no, I haven't.
And I'm making it up largely as I go along. And so, yeah, I had we were talking a little earlier, I had a patient recently who kind of joined the practice, and I had a phenomenal conversation with him that was exactly what I always dreamed the practice would be about, is, hey, this person's able to articulate their biggest dreams. We're able to tie that into rapid feedback right now. What are we going to do this week, next week to make those big dreams come true? And now my brain is going overtime trying to figure out, well, how do I do that with all my patients? How do I make that connection? Something went right in that conversation, and it wasn't going right at first. When I asked him, like, hey, what are your health goals? He said something about fitness or whatever, something vague that didn't really mean anything, right? And I was like, well, that doesn't really mean anything.
Right.
And I was able to provide the correct set of challenges, and he was able to provide the correct set of articulation. And I was able to find the right question to ask that I got this response. And how do I replicate that?
Yeah. I mean, you love when that happens, you're just, everything kind of clicks right into place. And, but yeah, how do you find, is it literally just like random, or how do you find more guys like that or gals, more patients like that?
I think I don't like to think it's random. I like to think that everybody has their lever, and I had to ask what I think is almost the same question at least 4 times with him. But the 4th time, it clicked. It made the connect. It was the same. It's sort of the same question, but it's phrased differently. So one of the ways I said is like, hey, what would it be? What is your concept of success? That's one version, right? He'd already sold his company for several $1 million. But one of the ways I asked the question is, if you had millions of dollars in the bank, what would you do with the rest of your life? Another one, and the one that finally clicked for him is, I said, look, imagine you're 150, you're on your deathbed, and you're looking back and you're like, I really killed it in the first part of my life because I had my career, I built this amazing business. And then in the second part of my life, I killed it again because what was that? Right?
You had him fill in the gap.
I had him fill in the gap. And that clicked for him. And I think part of algorithmizing this is trying to consciously build a database of I don't know how many versions there are. Maybe there's 100 versions of that question. And if I have a database that I know all 100 versions of that question, and maybe it takes 20 office visits to get through all 100.
Right.
But I will find the one that resonates with this person and will get that set of information.
Yeah, that's interesting. You and I have talked about apps before, but wouldn't it be cool if there was just like for your practice, an app that asked a question of the day, and
Sure.
There was 365 questions that got at what you needed to, so by after their first year of being your patient, you finally collected all the data.
Yeah.
In some way, it'd be rather than have them, because I think I remember you told me one time how long, like most doctors, you come in, you see them for 15 minutes,
Sure.
or, 10, 15 minutes. You probably spend more time with their nurse or one of their medical assistants or something.
Yeah,
but you actually spend a significant amount of time with your patients.
Yeah, all my visits are an hour at least. I book a minimum of half hour between visits in case they run over, so I'm never late for the next person. And if I have time, like this guy, it was the last appointment of the day. We talked for like 3 hours to get to the information.
That's crazy.
It was just like, okay, this conversation's going well. Let's keep going. Like, let's build on it, right?
Yeah, and it's so I think of course, think about like that's a magical situation, because a lot of times now we're so conditioned, me even as someone who believes in what you're doing, I make my doctor's appointment and I'm like, okay, I'll be there 30 minutes. You know what I mean? Like,
Sure.
And and then I didn't schedule more than 30 minutes. And if it starts running over, I'm thinking about it, all the other things so educating your people, saying like, no, this is different. And you might want to take half a day or whatever,
That's probably my biggest marketing problem in some ways, is what I'm doing, I think, and I think my patients would agree, is so different that until you do it, you actually can't know how different it is.
You can't describe it.
Because even that, just what you pointed out, it's not necessarily occurred to me, but yeah, I was perfectly, sun went down. We were kind of almost sitting in the dark, I didn't want to turn on the fluorescent light and whatever. But we kept talking until like, I think it was 7:30 or something before we called it or whatever. And we kind of came to a plan. We didn't call it until we came to a plan. And then we did. And I said, great, I'll put this together. We'll create a spreadsheet. We've laid out these feedback loop factors. And, we said we're going to check in every 2 weeks on these 9 topics. Right. And
It's awesome.
Okay, great. Like, but we didn't stop till we got there. Now, if he had been earlier in the day and we didn't have that time, that's fine. But I still had an hour and a half. And we say, okay, we didn't quite get there today. Let's think about it some more. Let's meet up again next week and let's keep at it, And just that idea of persisting until you get where you're going. I don't know. Yeah, I don't see that in medicine very much.
No, definitely not. It's like you said, it's like I think doctors are unfortunately put in a position of, hey, this is what I can bill for, and this is what the insurance company is going to pay me for, and because of your type of practice, you don't really have to worry about that as much. But probably, I'm guessing
at all. Yeah, no,
at all.
Don't take insurance at all, and so it's weird how much. It's weird how freeing that is, and I didn't even know how freeing it was until I did it. Here's some odd bits of information. The messaging app Signal,
yes,
right? Most secure messaging app in existence currently is not HIPAA compliant. Why? It's actually too secure for HIPAA. HIPAA actually requires there to be an auditable data trail in order to assure that it was encrypted, because HIPAA was written before the concept of end-to-end encryption really kind of took off.
Right. Technology has changed.
Yep. So now you can't use Signal for patient communication if you're HIPAA compliant, because there's no log, right? Not taking insurance, I technically am not a HIPAA covered entity. So I can actually use more advanced technology that is not allowable under HIPAA if it is better for patients, because I don't actually have to follow HIPAA, right? Because I don't bill insurance. It's that kind of stuff. The notes I write, we're taught to write notes in a particular way. And I came to realize, well, a lot of this stuff was just for billing insurance. It's not actually medically relevant.
Right.
It's not important to anyone. No one cares about this. I sat down, it was a 3-hour conversation. What did I write in my note? Right? I drew a diagram of, hey, this is what we came to. This is what he thinks is important. This is how we're going to measure it. These 9 factors, check in every 2 weeks. Signature. Right. It's a diagram. Literally, that's my note, is a diagram, because that was the content of that's the core of the discussion. Came out of it,
right?
Yeah. Was there an exam? He was breathing. He wasn't in distress.
Yeah. You didn't do his blood pressure, did you? Or
not that
did
day.
you? Yeah,
not that day.
Yeah.
I had done it. He had seen me like 2 days before.
Oh, okay.
So,
yeah.
But I assumed his blood pressure hadn't become abnormal in 2 days. But,
right.
Yeah.
He was, and so I'm curious also with these inquiries that you do, you know, these interviews that you're doing with your client, you call them patients, clients, members?
I call them all of the above at different times.
With your people. Do you have, like, with the plan that you try to present to them, is there somewhat of an already preconceived structure to that? Like you mentioned, there's principles of your, is it
Osteopathy?
Osteopathy.
Yeah.
You know, one of them had something to do with mind, body, and soul, or something like that. So are there certain areas that you're trying to work towards?
There's an algorithm that's in the back of my head, sort of vaguely. So I think health obstacles, again, so the principle is the natural state of the body is health, right? So if you're not having as much health as you want, there's an obstacle in the way in some sense. I think those obstacles fall into 5 categories. One is congenital and genetic issues, stuff you were born with. Cognitive, relational, I call it the internal category, spiritual issues. External, so behavior, environment, habits, that kind of stuff. Traumas and holdovers, scars, whether physical or emotional. And then the last category is what I call acute issues, and I put all of regular medicine there. So, like stuff that will kill you before we can talk about anything else. Right. So, I mean, if you're diabetic and completely uncontrolled sugars, well, we need to get control of that before. Yes, you should also work on behaviors and cognition if you're depressed or addicted to food or whatever's going on. But we also do need to probably prescribe medicine and make sure that we get these things under control so that you don't have damage while those behavior chains are hopefully having their effect. But those are my 5 categories in the back of my head.
Yeah. And so, is there, like in that particular case, the example that you shared, it was like you drew a diagram or a graph or something. Is there a normal structured plan that you might issue them, or they all look different depending on the person? Like some people get the diagram like that guy did, and then some people
he and I made that up together.
Right.
In the moment.
Yeah.
And now I'm thinking, and this is part of the excitement is, hey, that was awesome. I think that's really going to help him. Do I need to be doing that with everybody?
Yeah.
Right. So now that moment of success, you start saying, well, should I algorithmize that, or is that something he needed and not everybody needs? So I'm going to have all my patients in one by one, and we're going to say, hey, would it be useful to start doing this? And if it is, it is. If it's not, it's not. And we'll try and figure it out, and we'll kind of go from there.
Yeah, I mean, that's the fun of the, and that's why I do feel badly for other doctors and stuff who are hampered by, you know, maybe not even having their own practice. They work in someone else's practice, and it's all so very regimented and structured, where you have this opportunity to be entrepreneurial and creative and do stuff that, and that's why I could just go be a trainer at someone else's gym, or I could do a lot of other things, but it fascinates me to create something that might work for a lot of people. I mean, the athlete progression guide is a good example. It took me 5 years of tinkering and ideating and throwing it away because I couldn't deal with it anymore.
Yeah, absolutely.
And it just evolves and the hope is that this is going to serve some people, and this is going to make a difference, you know?
Yeah. I mean, I think that's the dream. I think that builder spirit, that idea of wanting to create, to put something out in the world and have it take form. And I'll say, you know, I've certainly run into many physicians who don't necessarily have that in the same way and provide amazing service for what they do.
Oh, of course.
And I think the other challenge realistically is there's a emotional aspect and a pragmatic aspect. The emotional aspect is, as you know, I'm single. I don't have a wife, kids depending on me. Right. And I, you know, fly out to the border to take jobs to pay for the practice that doesn't have enough patients. And yeah, you know, I graduated 2011 and started the practice then, and I've had to iterate it and change it, and it's failed and crashed and, you know, pulled it back out of the ashes and all that stuff. And I don't think I could have done that if I had kids.
Yeah, that's interesting. Do you see this works for you right now? as it is now for the reasons that you stated. But yeah, a good example is, would you have stayed 3 hours with the guy if you had to be home to eat dinner with the kids or something? Or I don't know if that's even a goal. I don't want to make assumptions. But
no, it is. It is. I think that's something that I definitely feel has passed me by in my life in some ways. Just had my 40th birthday recently, and so it's kind of, thank you. But yeah, it's definitely something that kind of never quite gelled in a way that I wish it would, and still look forward to hopefully maybe someday having. I think it will take and this is a little bit old school and maybe not PC in some ways, but I think it does take a particular spouse for that to happen. I feel like there were reading diaries or stories about older doctors and their wives. I think their wives felt very much a part of what they were doing. Is that she was a part of the medical team because she was making sure his personal life was taken care of, so he could stay an extra 3 hours, and when he got home, everything was lined up because he was going to be exhausted, right?
Sure.
And that was part of the care that she provided to the community, was through supporting him, right? And there's kind of like, there's ideas like that in I imagine, military or in other areas where the support part of the organization is still part of the organization. And I feel that mission and purpose in what they're doing.
Very much so in the military. You mentioned the military, and I hadn't really thought about that till the second you said it. But in the military, they've got what they've called like family readiness groups, and the family is part of the unit.
Yeah.
And because when all of us get sent overseas, if things aren't okay back home, and if things aren't, then things aren't okay over there.
Yep.
And so obviously people learned some general or something learned a long time ago that we have to incorporate them, or things aren't. This ecosystem isn't gonna work. So I've seen that. I always wonder about that because. People who go out there and do great things, like, you always wonder about their family. What's behind the scenes that we don't see? Like, is it kind of a train wreck?
Yeah,
because
a lot of times it is.
They've had to stomp on, or they've been divorced 5 times because no one could, I always wonder about that,
A lot of times it is, but there are also those who, by all reports, at least, actually manage to kind of have it all, right? And a lot of times it's not down to them, it's down to the other half of that team.
Sure.
And maybe to the degree that they allowed that other person, it goes back to what we were talking about, kind of intimacy and vulnerability, is allowing that other person to be a part of what you're building and say, hey, yeah, I'm staying for 3 hours, but we're doing this together. There's also that sense of community. And I think that's something else, I was very honored, actually. One of my patients invited me to his housewarming party. And I went. And it was fascinating because doctors aren't typically a part of patients' lives in that way.
Right. You were like, yeah, and that's cool.
Yeah. It was sort of, it made me think about my grandfather and kind of like practicing in smaller town medicine and this and that, where you are more a part of the community. And something that I would like to incorporate more and always dreamed of was, hey, yeah, okay, we have these members in the clinic, but in an ideal world, that could be a community that's kind of dedicated to health, dedicated to pursuing dreams and building up. There are privacy issues there, and there's all kinds of, stuff you could trip on, but you can work through that stuff. It didn't come up at the party. We had multiple patients there, and nobody asked me any medical questions, and nobody, everybody was respectful, and it just didn't come up. I didn't have to draw any firm lines or anything. It was just cool to let people share, and it gave me insight. Even one of the guys is coming in now, and I've been kind of brainstorming how we're going to have that conversation, and how the appointment's going to go, and I know what he's dealing with, and he kind of gave me a heads up. But it's also informed by what I learned about his background when he was just talking and just being a person.
Yeah, getting to see, I could only imagine being a doctor and getting to be welcomed into somebody's home to see what their habits are like and how they live and what they believe and what their culture. I mean, it has to be nothing but benefit to be able to serve that person.
I mean, I certainly think so. And I don't know, the pandemic's also been an interesting experience for me, or early in the pandemic. It's faded out now a little bit. And something that I imagine you must also get in the military to some degree, the idea of being thanked for your service.
Yes. Right? Yes.
I had never had that in my career until the pandemic. Right.
Really interesting.
Yeah. And it actually, I was really emotional about it. Like I actually got really teary eyed. Like I was in a small town, kind of height of the pandemic, pre-vaccine. It was really a scary time for a lot of people, whatever. And I had worked my shift and I ordered a steak from whatever, the small local steakhouse or whatever, and went out to pick it up. And I picked it up and they were dropping it off to the cars, no going inside or whatever. And they dropped it off and they said, "It's on us." And I was like, dude, that's never happened. That's amazing. Never happened. And, you know, I mean, it just, Scrubs talks about this, great show, but, you know, back in the day in the 60s or whatever, like, you know, doctors were a part of the community and, you know, barbers would give you a free haircut if you came in your white coat and, you know, this and that. And now, most of those things we see are, and I'm not, there's no like sour apples here, it's just observation. Sure. It's nurses, first responders, police, and doctors aren't a part of that group anymore.
Interesting. I never really thought about that, but yeah, I mean, I see that.
And part of that is the salary differential, right? Certainly we make more money and,
don't feel sorry for this guy.
Yeah, totally. I think and there's a fairness to that, I think.
I don't know if there's we already talked about how money doesn't really mean anything.
Yeah, it doesn't in the deepest analysis, but it does matter.
It
right?
helps
in terms of like, and it's a matter of whether you're considering it in terms of like the monetary value of the haircut or the steak, right? Or are you considering it in the community value of the steak? Those are different things.
Sure.
And yeah, the monetary value, it doesn't make that much of it probably makes more of a difference to, and I even objected. I was like, dude, it's a pandemic. You're a restaurant. Like, let me pay. Like, I at least have work. Like, you know, and they were very firm. They wouldn't take it. And, but that was kind of the thing, is that it made a bigger difference their bottom line than it did mine. I can afford the steak.
Right.
But as a community building, I mean, I still feel tied to the town.
Right.
Like I was there for a week, but like, God, I fucking remember that, you know?
I mean, I have to say that, I mean, cause I can relate, because I am in the military and I'm often in my uniform and I'll go eat lunch somewhere.
Sure.
And it happens a lot that people will just, hey, someone paid for your meal.
No, wow.
Yeah. And it's always such a humbling thing, you know, especially like I haven't been to combat in so many years, you know. I mean, I you know, that was like, I think the last time I deployed was like 2003 or something like that. It's been so long.
I don't know if
you know?
that kind of thing fades though. I mean,
again, it's like me, like again, like feeling weird about it. But I think it's such a cool thing for people to be finally, especially, I guess it took a pandemic for people to recognize that how you're on the front lines. And
sure, yeah, I think that's, you know, thankfully, it's a product of medicine being, in this day and age, pretty successful overall. You know, we've always been on the front lines in terms of, you know, we have patients come in with TB and got to go and take care of them. You know, TB is far more infectious than COVID, right? And we do, you know, we flu. Yeah. You know, I remember in residencies 2009 with, you know, the swine flu. That year, kind of went through the whole nation. That was an early pandemic, right? Not nearly as fatal as COVID, but still pretty serious. And yeah, it hit me. I'll never forget this. It hit me about 4:30 in the afternoon, the night that I was on call, and we already had so many residents out with the flu that there was no one to call. There was no one to take the shift. Like, and so I literally, like, I put a mask on and slathered myself in alcohol to the elbow and like went and admitted patients and then went back to the call room and like just shivered there. And then like woke up and like saw the next one and went back and shivered. And so, yeah, I mean, physicians have been a part of that, but I think it's easy to forget until something kind of doesn't work. And I've often said COVID has been, for physicians too, incredibly humbling because it's back to Civil War medicine, pre-antibiotic era. We're used to being able to pull people back from the brink of death unless you have like 8 organ systems that don't work, right. You know? But in my career, the people that died, sounds weird to say, but the people that died without my permission, like not because we withdrew care, not because
you were trying,
whatever, not because we knew like, oh God, you know, this guy's got stage 4 cancer and there's just whatever. But the ones that, you know, that just died, you know, young guy had something, didn't go right, suddenly his lungs filled with fluid and he died. And like, I still remember that case because it was not what we expect. And COVID, that's every day. You know, 36-year-old guy comes in, maybe he has diabetes, obesity, whatever, 1 or 2 risk factors, but overall young, pretty healthy, and just dies. And there's nothing we can do. We just watch them. And that's
imagine.
Humbling. Yeah,
and seeing how many, and just knowing how many cases of that have happened. It's not just like one, you know? I kind of on that same subject, you had sent me, you had written up a whole thing on coronavirus and like what works and what doesn't work. And I thought it was so helpful.
Good.
Yeah. And I, you know, just for people listening, it was kind of like, here's some of the treatments that are out there. It was just such how I hold certain professionals up to a certain standard of objective, you know, just assessment of things and like doing the homework. And I thought it was just really well written. It's like, you know, here are the facts or you know, here's the data. And so, one, thank you for, I mean, must have taken you how long did it take you to write that? This was about coronavirus for everyone listening. It was kind of like
if anybody's interested, riverrock.pro/COVID.
riverrock.pro/COVID. It'll be right up there. Yeah,
it'll be right there. So, it took me probably a week to put together of writing. I don't know, 3-4 hours a day. A lot of it, and that's fast, but a lot of it was I already knew the data. You know, I've been studying this for a while.
Yeah. So was that spurred by, you know, what was your motivation for like wanting to do all that work?
My patient told me to do it.
Oh, one of your patients wanted it?
They were like, well, they said, hey, we've got all this great information from you. You have these, and we ask you questions, but it'd be really great if you put like and they even gave me the title. They said, put together a paper that was just like the current state of COVID and just kind of keep it up to date. And I was like, that's a great idea. And so I did it.
Oh, awesome. And so
when you engage with people that way, they tell you what to do. Okay.
Which I love. Again, how often does that happen with anyone else's doctor? Sure. You know, you get that kind of input and they actually, and you know, they might say, yeah, that's a great idea, but I'm not going to do it or whatever. Sure. I don't have time to do it. So I love that. And I love that you put that together.
Yeah. I mean, I think it made me reflect too, because as I was writing it, I tried to get, and I actually have a lot of sympathy. And I think that came through in the document, a lot of sympathy for the anti-vax, more than most doctors, I think, the anti-vaxxer concept, because I think that, and that's what my practice is a reaction to, is the medical establishment has broken trust with the communities they should be serving. And some of that's misinformation, some of that's a well-intentioned attempt to control people into being healthier, which is never a good idea, but maybe sounds like a good idea sometimes. And yeah, without, again, very honored by the trust that my patients put in me. I had one patient who put it very flat, but had most of them actually operated the same way. Is, you know, when the vaccine first came out, I was like, you know, it looks pretty safe, but maybe not safe enough for a 40-year-old. It's probably, you know, I told my parents to get it right away because they were high risk from natural COVID, but I didn't get it for several months because my risk was lower, right? So I needed the vaccine to be proven to be safe enough to know the risk benefit there. And my patient was like, well, I'm about your age. I'll get it when you get it. And I did. I emailed him. Sure. I said, hey, I got my first dose of vaccine, just so you know. And he went out and got the first dose of vaccine. And so there's that trust there of like, hey, you're looking at the data. And he knows that I'm not afraid to buck the establishment. Like, I've said the establishment's wrong on statins for more than 10 years now. Wrong on aspirin, which is finally, I think, hit the news.
Yeah.
10 years later. Sadly, the average time to implementation in medicine is about 13 years. So the study that came out on aspirin being the best first line treatment for an active heart attack, it took 13 years for that to become standard of care. And unfortunately, medicine, and there's a lot of reasons for that, good and bad, and you're not going to get that down to instant the way we would like it to be, but 13 years is excessive.
That's a long time. Yeah.
And so, the idea of aspirin no longer being the ideal or not being a good preventative, I was aware of those studies in residency that were, and that was more than 10 years ago. I'm just now seeing the headlines, but yeah, it is kind of crazy. It just, they know that I'm not afraid to buck the establishment, but that I do it on the basis of what I've read. And I can generally say, hey, this is why I believe what I believe. And if I tell them, hey, I believe this because one of my attendings told me this when I was in residency and I have no scientific justification for it at all, that's what I'll say.
That's your truth.
And that's what I know, right? Or that's how I came to that conclusion, right? If I have 10 studies backing up the opinion, I'll tell them that, and I'm happy to send them the citations. If, however I put that belief together, I convey it transparently that this is what I think, this is why I think it, and this is how sturdy of a belief I think that is. A lot of times I tell them, hey, this is what I think, but that's actually not that sturdy of a belief. So if you disagree with me, I wouldn't blame you. Right.
Right. That level, but that's that level of transparency and honesty that I feel like we all want and often feel like, you're right. You said the trust has been broken in a lot of cases because we don't feel like we get that. Well, it's probably just because of the system. Like, again, you get 10 to 20 minutes with your doctor. There's no time to build trust in that.
Yeah. And that is the problem is the idea of industrializing medical care. It ignores the human element of trust. Is how are you going to build a relationship with a patient? And the average is 12 minutes, by the way. No, the national
that's the average of like
face-to-face time.
Wow, 12 minutes.
Yep. And here's a worse statistic. The average time you get to speak before the doctor interrupts you is 23 seconds.
Wow.
I mean, how are you going to build anything?
No way.
Right. But, and that's why we overprescribe. That's why despite multiple campaigns, we still give antibiotics for colds, right? We still do things. We still give opiates for back pain. We still do things we know we shouldn't be doing medically, but it's the only thing we can do that will, again, we're serving the relationship to the degree that we can. Is I don't want you to leave here upset because I want some sort of relationship with you. And the only thing I can do is give you something you want.
Right. Give you what you want.
Or think you want. Right. In order to preserve the relationship. And that's why we make those medically bad decisions, is because we're not able to preserve the relationships without them. It's a really bizarre situation where doctors are doing these things, right?
I mean, and I get that. I understand why that happens that way. Shifting gears a little bit, completely. So what's your definition of optimal health? So part of this podcast is about optimal health.
Yeah.
And so I'm on the search. I'm hunting. What is that even?
So this goes back to kind of what we were talking about before, right? Is what's your definition of an optimal amount of money? But without a goal, you can't define that, right?
Yeah.
So it is very individual. Optimal health is always going to vary by the individual. If your dream is to, run a world record time in a marathon or something, you're going to have a very different view of health, because your health is going to be the thing that serves that purpose, right? If your view of success is having a really amazing family life, that's going to be a very different definition, right? A lot of people default to longevity or health span, the amount of time that I remain functional and healthy and interactive. And I've been accepting that answer from patients, and I think I'm going to stop. It's not sufficiently useful. I need to start asking trickier questions like, why should you be allowed to live that long?
Yeah. Or like, what do you want to do with those years?
Yeah.
Yeah. In my world, we always talk about earn your progress. Like you want a 500-pound back squat. Well, you're not going to just jump under the barbell and back squat 500 pounds. You got to earn it. And so maybe in your case, it's like, what do you want to do to earn your longevity or something along those lines?
Yeah, I think there's something along those lines. I think in terms of our vision of optimal health, I think where that goes is what's your ideal version of yourself? What is that picture in your head? Is who, how does that person behave? I'll tell you, even from a very personal standpoint, I love the show House.
I used to watch it a lot. Yeah.
I have a very similar character in that I'm very driven to find answers. I love the puzzle of things, and I'm not as caustic or abrasive. And even though it's medically not realistic, it is personality realistic for me in a lot of ways. And I realized, and it helped me get through residency in a lot of ways. What I realized after I graduated, enjoying that show spoke to the parts of me that were broken and gave me sufficient purpose to push through the brokenness in extraordinary circumstances.
Right.
And that's valuable, but it also became a limiter. And I realized this reading a book from childhood, Wizard of Earthsea, where the ideal that was presented was something I also identified very strongly with, but was a story about overcoming brokenness. And I remember though, I was like, look, I have a choice in front of me. I can continue to identify with my brokenness, or I can consider the possibility that is a crutch that is keeping me from growing further and keeping me safe in saying, well, this is just how I am. And so, yeah, my all that to go to say, my ideal version of myself had to change. I had to go back to an older version, an older ideal that I had maybe as a kid.
Right.
And start aiming higher.
Sure. In that regard, let me see if I understand that right. So you're saying that accepting a part of your brokenness as it being like, this is who I am, you felt like that was a limiting factor for you, just kind of like this is who I am, this is how I do things. That was kind of holding you back. It was, it was both, right? It was, we talk about this in fitness is, what got you here won't get you there. Right. And that's exactly what it was, is like that identification with brokenness got me through residency. It got me through crazy circumstances in my personal life that were going on at the same time. And the situation was so absurd that I had to be absurd in order to kind of get through it. Right. Yeah. And being able to be caustic and cold and kind of, and there's still parts of medicine that like, hey, medicine's brutal. Yeah. There's sometimes no room for the emotional response. Yeah. But that's not everywhere. There is room at other times for the emotional response, and just hanging on to that cold side because it's easier or more familiar maybe became limiting. There was a lack of spiritual growth that I was blocking from by saying, hey, you know what? Like, I could actually be better than this. Right. I could be better than I am. Well, I love that. I mean, just from the perspective of being a human being, we're in survival mode a lot, and rather than think, let me find ways to become more whole, that can be a scary endeavor, because what's gotten me through, like you said, what's gotten me to here, my survival tactics feel safe. They feel like, okay, I know these. This is like the evil I know. Yep. It's like anything. You can take even mundane examples, right? If your roof is leaking and in multiple places, and you probably should repair the roof, but you don't have time, you don't have the money, so you patch it. If at any point you actually want to actually fix the roof, which you probably should, you have to take the patches off. Right. That's the first step. But that's scary because the patches are what's holding it together right now. Yes, that's a great example. And I've kind of gotten used to, one of the things I say to myself is make decisions that give me more options, not ones that take options away. And when I've kind of lived through my scarcity mindset and through fear and through survival, that's really, it's not giving me more options of ways of being. And so I try to catch myself doing that when I can, reverting back.
Sure. And there are still parts of me that, I like what you said about options. I have that house side of me. And yeah, sometimes in the middle of the hospital shift or whatever, it's crazy or some insane thing is going on, and you kind of drop into that mode, right? Yeah. But then I'm also able to let go of it and kind of be more at peace, be, a little bit bigger focus, a bigger picture.
Sure. Like having it as a tool in your tool belt, as like a thing, I usually don't talk about my military stuff that much, but in the military, one of the things I like about it is like, I'm not at all an angry person or a person who's very dramatic or, but I've learned that in certain circumstances, standing up, sliding all the shit off of someone's desk and getting real loud creates an effect of some sort. And sometimes in the military, like having the ability to be able to do it, even without being angry, it sometimes gets to a desired end state.
I talk about this with my mom and my sister are both incredibly empathetic and compassionate people, and agreeable, and struggle with the consequences of being that compassionate and agreeable.
Absolutely.
And so Taleb is one of my favorite authors, and another one of his sayings is you need to be kind, agreeable 95% of the time. And 5% of the time you need to break chairs. People know you're capable, and when they think about interacting with you, they know you're probably going to be nice. But if you're asking them something or if they're asking you something that's particularly problematic, they're going to think twice about whether they're going to get the chair breaking, right?
Right. Yeah. And it's one of the presidents, it might have been Truman, said, was it speak softly, carry a big stick?
Yeah.
I don't remember who it was either, but Roosevelt. Right. Same concept, and it's just nice to be again, be choosing it rather than to be controlled by it.
And I think that is the key is once it's a tool in your belt, then you're choosing. But if you're just an angry person, then that's also not in either direction. Right. It's not a choice unless you have all the options.
Yeah. I have a horrible history of people pleasing, and it's frustrating to me now because it's not like a big problem all the time. It's not a problem. Be nice and compromise. And there's certain things but oftentimes it's at the cost of me doing either what I know is right or what I really wanted to do, or, and so I've really gotten myself into trouble with that.
See, I'm the opposite, actually. It's not that I'm aggressive or negative, but I very much am comfortable going my own way. And I've struggled throughout my academic career in dealing with any administration. And even as a physician, like literally, before the pandemic, one of the chief of medicine at one of the hospitals I work was like, look, dude, just don't ever message administration. Just send me whatever you want to send them. And I will, you just can't. It doesn't work. Because I just have I just am not that, not that I curse or anything, right? But I make my point very firmly.
You're not going to go along to get along.
Yeah. But, the consequence of that is I don't build consensus very well in groups or in organizations. I even in personal relationships, that can be hard when, if the person just doesn't have an ability to compromise. Well, that's kind of difficult to deal with. Right?
Sure. It takes a special kind of person, like you said, like certain kind of friend to be accepting of that and understand it and even support it. In some ways, which is the other part of what the podcast is about is, I say deep human connection. It's something that I really long for, and I've prevented myself from by being a people pleaser all those years. I was really blocking myself from deep, true connection with other people because I never allowed them. It was really for me a survival tactic. Sure. It's just like, I'll go along with whatever you're saying. Just don't throw me to the wayside. Don't throw me in the garbage.
Sure.
And now being who I am now, it's like, I'm okay. Like I understand that when we don't agree or whatever, you can't even throw me away. It's not even possible.
It's funny because in some ways it was the same concept. I just took the other tack. Is like, if I get even the slightest hint that you might throw me in the garbage, I'm just going to jump in the garbage.
Right.
and just be like, all right, well, we're done. Like,
Right. Yeah. I'm going to run away.
Go my own way.
Yeah. I'm going to run away from you so you can't even get me into the garbage.
Correct.
Yeah.
Correct.
Yeah. So, right.
It's
So
just
we're all on some side of that coin,
Yeah.
I think.
Yeah.
It's
And I
like
mean,
fear of-
like, there's benefits, certainly my practice, my willingness to build this practice outside the structure of standard medicine is very much my own recognition that I'm not going to do well in the standard administrative system. Those things track together, but then there's also the problem of, well, I work alone, right?
Right. You're
And
accepting the life of the lone wolf.
Sure.
Well, I'm curious though that with your practice, as you have these deep inquiries with your clients, members, patients, whatever we said we were calling them, do you find there's a level of connection there, or is it fairly transactional? It's like you're still kind of getting to an ends, or of course there's professionalism, but I mean, is it like in my world there's a huge part of being, a coach to someone, a strength coach to somebody that is connection,
sure.
Beyond what's happening in the gym.
I don't know. I think going to his house was really meaningful for me because it kind of broke that barrier when he invited me to his housewarming party, and we kind of went and experienced a different side of things. That meant a lot to me because it was breaking that. It is still fairly transactional, maybe is a bit harsh. It is still pretty directed. I think most of my interactions with my patients, I think my dream for the practice would be to continue kind of breaking that down if they're receptive, to the degree that they're receptive. It varies patient to patient, of course.
Yeah. Do you think, not to cut you off, but do you think people long for that with their doctors? Do you think that people want a deeper relationship? I mean, it's very personal thing that people deal. I mean, things that I've had to go to a doctor for sometimes are not just the sniffles or something, and so I'm curious. I don't even know the answer for myself. Do I want that with my doctor?
I think no, not completely. You want about half, right? You want enough to feel safe and comfortable, and you want trust, right? But you also want them to be a little bit of a neutral third party stranger, a little bit, because if it's a friend, if it's actually a friend, unless it's a super intimate friend, so that's the other side of it, right? Like my best friends,
there's no middle ground.
Yeah, there's no middle ground of, well, we're friends and we have a social interaction or whatever, but now I'm a little shy to kind of bring up my, herpes or whatever.
But is that because I'm wondering, so right, I can see the situations in which you maybe don't want your doctor to be your friend, right? Like
sure.
You brought up an STD, maybe that could be embarrassing to you, but I was also thinking about the scenario.
I like to party on the weekends and do these drugs or do whatever. Yeah. And all of those things start to become.
I'm addicted to whatever, So, but I'm actually thinking about it being harder for the doctor in that case, like because I can see where you might make some ethical decisions for or what you might do for a friend versus what you would do for a stranger, or the way you might make certain decisions or whatever.
Maybe it's funny. This kind of goes along with that personality trait of not going along to get along or whatever. Like, and my mom still struggles with this, I think, but I pretty clearly, I think, compartmentalize my emotional set from my analysis. Oddly enough, the more I care, actually, in some ways, the more I push the analytic view.
Well, that's kind of what I was hoping you would say, is that like, no, if we have a really good relationship, like a great relationship, and even we would, we'd consider each other friends,
Sure.
my thing is like, if you're professional enough and we care about each other enough, then you really probably would be making maybe even more solid decisions in some ways.
I've always thought so. Medicine has legally and socially has all these ideas of, you shouldn't treat family or you shouldn't whatever. I've never really understood that, or I understand it third party, meaning I understand that some of my colleagues, I think, may be sufficiently emotional about family that they would be impaired in their judgment. That's never really rung true to me. And there are norms that I follow just for keeping my license safe. But yeah, I think I do give better advice to patients when I care about them. And that's part of the rapport that I try to build. I probably think about my patients more than they think about me. I'm at some point a bit player in their lives, right? Whereas they're a big part of my business.
Sure.
Anytime I come across an article that is related to something one of my patients is facing, I think about, hey, what can I learn something? Should I be doing something differently for them? They're always on my mind in that sense, but that's because I have a relationship, because I care, and because I want to give objective analysis.
Because you know them.
Yeah.
I mean, you think they come to mind when you see the article because you have a relationship with them. You know, there's the details about them, and you know, and so I think that's powerful.
And my mom also, I don't know, you know, I've got several of my own stories, but the one that comes to mind, when I was 2, I pulled a hot cup of coffee down on my head, and it gathered in the diaper and burned me in the diaper area. And it was pretty bad. I was in the hospital, and my mom took me home and had to do the dressing changes and like scrub the area. She is very empathetic, like my pain, her pain, like she, you know, but she did it and did what had to be done despite how much it hurt her. She was crying. Her report, I don't remember it obviously, but yeah, I think that idea of being able to be harsh enough to be compassionate. Or the other quote that comes, Ender's Game, we talked about briefly, the sequel to that, he's in a situation where for whatever reason, his best friend has asked him to help him die. And he's going to kill his best friend that night or whatever. And his wife says, you know, I think you have the heart for what you're about to do. And he's feeling kind of bitter about it. And he goes, what? Cold and ruthless? And she says, no, compassionate enough to put the fire to the wound when that's the only way to heal it. And that to me is like when I am harsh or when I seem harsh, for me, usually it is a form of compassion. It's me trying to be compassionate, and it may come off. Yeah,
when I do staff development with the coaches, as you know, one of our values is kindness over everything, and I tell them all the time, don't mistake that for, you know, being sweet. And sometimes the kindest thing that you can do for anybody is to be hard on them, to hold them, to do something that might kind of hurt, be uncomfortable for them right now, but it's out of love and compassion. And knowing that there's a bigger purpose, you know,
for sure. And with any relationship, you know, I mean, not that I'm a bastion of like successful relationships.
I've made a lot of mistakes that I could, you know.
But you know, to be able to say like, if I really care about you, I'm going to tell you how I perceive it at the very least, and how I perceive what you're doing may be a mistake, and you can disagree and we can have that conversation.
Sure.
But I'm not going to hide from you that I think you're making a mistake, because that would seem to me, that would feel fundamentally unloving.
Yeah, and it really is. I mean, you know, I think the level, if you're hiding, you know, it's still, if you're hiding or lying or withdrawing some sort of something from somebody because you don't want to hurt them or whatnot, it's not loving. There's nothing loving about that.
And to be fair, I mean, like, it's not like you have to say everything, right? Like right away, but like, I try very hard not to lie in response to a direct question, even if the answer is somewhat painful. And then I do try somewhat to choose my moments about when to bring up. Like when is the right time to bring up this topic,
there's definitely a like skill.
Yeah. And one of my big failings is I probably wait too long, or I'm a little too, well, you've got all these other things going on. I don't want to pile on, and, you know, so on and so forth. And so then it can be a long time before I actually bring something up.
I'm not particularly good at that myself.
Yeah. I don't know. I feel like there's that survival thing going back to, is like, well, I can make do. And so it's not exactly what I want, but I also don't want to pile on top of you and whatever. So,
Relationships are just hard. They're just so hard. We one of the things that wasn't recorded earlier when we were talking about how you were mentioning there's studies. It's very correlated with, you know, being in a relationship. You live longer and all that other stuff. But
men, oddly enough, not women.
Oh, interesting.
That's
that's sad.
No, the interesting thing about that, and I think there are social norms there too. I think women are better at forming intimate relationships with friends, with other women. And remarkable, actually, some interesting article, not necessarily, the military is actually to some degree the exception to that rule, but we don't have good manhood rituals, and we don't have good passages that help us form really deep masculine relationships.
Yeah, it's interesting that you bring that up, because I have another friend. He's a doctor he's a chiropractor. but he's big on the rite of passage, the ceremonies for men in particular, that ancient, past cultures, ancient cultures had these rituals. Other countries sometimes have them, and we here in America don't really have anything like that. It's interesting that you brought that up, because I've been thinking about that.
Yeah, it's an interesting, that transition into adulthood, and not just adulthood, but the shouldering of responsibility to a purpose.
Yeah.
I think that buddyship is the word actually that I've heard used. Buddyship. Yeah.
Yeah. And I have to agree with that. Like, again, in the military, we do get some of that, because, you go to basic training with, or you go to war with, or you do hard stuff together, and that really bonds you. But a lot of folks don't have, sometimes team sports is like that for some people, that's something where people build like lifelong relationships. But I agree with you. And I can say for me, of course, I do have, guy friends or whatever, but it's not like women do, where they kind of like, they really come together as like a bit of a pack within the pack,
Yeah. And I'm fortunate. I recently have one of my friends is a decade old, my best friend from residency, but recently made another such friend, guy friend, and having two of them in the same city, I've not had that kind of close set of relationships since high school.
Has it been an improvement to your life? Like, have you?
Incredible.
Yeah. Isn't that crazy?
Absolutely dramatic. It's difficult to overstate.
Yeah. How would you, what would you say is different? Why is it different?
I don't know. It's a qualitative difference, so it's a little bit maybe difficult to it's not quantitative. There are things you can point to, right? If I get turned down for a date, or I go through a breakup or whatever, I'm not just alone in my head. You have figuring it out myself. There's somebody to bounce the ideas off of. Somebody I'm comfortable with telling all the details of what went down.
Right.
No matter how good or bad it makes me look.
Without fear of judgment. And and wow, that's powerful.
Whatever. Yeah. I mean, like, hey, whatever the deal is, no matter how extreme, if I whatever, I got high on cocaine and slapped her, and then she broke up with, well, okay, like, who are you going to tell that to?
Right.
Like, not something you really want to put out there. No, right?
You've got to have someone who you trust. And
and I think in our society, we've ended up, therapists and doctors end up in that role, but we're not suited for it. It's not, there can be value in getting a third party trained opinion. So it's not that there's not good work to be done there, but it's not the same work as an intimate relationship with somebody who you can say that to, and who will chew you out, but also say, hey, we're going to put the pieces back together.
Right. Yeah. And I mean, that's the hard part about, being a friend to somebody else, a friend to somebody else is really hard too. It's,
for sure.
It's not only just hard being able to make yourself vulnerable for others, but also not allowing your bullshit to affect how you support another person when they come to you with something like that, or, and that's just the beauty of the whole thing. I think it's just like how you are willing to set your shit aside, for someone else, or become more accepting, be a human being, it's hard.
No,
it's really hard.
No, it is very difficult. And I think there's also a certain degree of chance involved. Finding someone that you resonate sufficiently with is a little bit difficult. And I'm a very analytic, intellectual person. And so, we can talk about emotions all day, and I won't necessarily feel particularly close to you, right? But if I tell you my ideas, hey, this is what I'm excited about, this is what I'm working on, this is what I'm thinking about, right? And it's not what most people find bonding.
Right.
That's usually the opposite for most people.
Interesting. Right? Because I think I'm with you. Like, if you, I could just talk about ideas all day long, and I mean, that stuff, is exciting to me, but yeah.
And since I identify so strongly with that, I feel connected with people when I'm able to kind of riff on ideas that way. And it's difficult because, like, sometimes the idea I'm having is based on like 4 college courses. And so it's like, well, and I've noticed that with my friends, like, we speak even in this conversation, actually, if you end up listening to the podcast here, you can even notice how long each one of us gets to speak. It's an unusually long period of time.
Yeah.
we give each other space to say, okay, yeah, sure. You want to talk for 5 minutes, 10 minutes at a time, whatever, go for it. Right. That's unusual. Most people don't have conversation that way. And I have to adapt to the more normal style of conversation. You get 30 seconds to speak on that, whatever, politely to give the other person room. Whereas my friends and I, people I'm close to, tend to speak in monologues of minutes at a time. And then you get your several 5-10 minutes to speak.
Your turn's going to come eventually.
Exactly.
Yeah.
Exactly. And you count on the other person being, I had ex-girlfriends who would get upset, like, I just can't keep track of everything you said, right? Like, I need to take notes or something, right? And so there's also a capacity issue. If you're talking about really high level ideas and you're juggling through them and whatever, and if the other person isn't interested or doesn't have the background, the educational background, or doesn't have the raw intelligence, depending on who you're meeting, that can be a problem, and it's not their fault. It's not anybody's fault. It's just,
you used the word resonate earlier, and I think about words a lot, and I also think about things that happen, the unseen thing. Do you think that, because I've heard people say this, some of my more spiritual friends will say things like we vibrate, like the reason why some people, the word vibe, people together is because some people believe that there's a energy or vibration that humans have, and then we basically find our tone. Like, I don't know anything about music, but if you're playing at a D, I know that's a tone, and maybe I'm playing at a D too, then that's why we connect. Do you think there's something to that, like physiologically or spiritually? I don't know.
Yeah. And where's the overlap between those things? Right. Certainly physiologically. And again, so we're talking about transparency. This is one of those beliefs that does not have the best scientific grounding. The body certainly has multiple rhythms. Your heartbeat is one rhythm. Your breathing is another rhythm. So far, I'm on firm scientific ground. You can go a little further, and so there is something I have become quite taken with, which is called resonance frequency breathing.
Yeah.
Seems to be related to the length of your inferior vena cava, but there's a frequency you can breathe at, creates a reflex increase in your vagal tone and sort of ramps up your parasympathetic nervous system and ramps down your sympathetic nervous system. And the effects are fairly long lasting. So you do it 20 minutes and you kind of get a day's worth of work out of that. And it's purely physiologic. There's no meditation that goes along with it.
Is that I have a lot of friends who are also into this, but Wim Hof has like a whole breathing thing.
I am not. I know Wim Hof has a breathing thing. I don't know what it is. I haven't studied it. So I don't know. I mean, I've dabbled in it, like again, hanging out with buddies, and they'll kind of like show me what it's like and like lead me through the process a little bit. But I haven't gotten into it. So I was curious if it was the same thing. Yeah, no, I haven't either. And then from the osteopathic perspective, we believe, feel, maybe we're mass hallucinating, a sort of deeper rhythm in the body tissues that doesn't necessarily seem to follow breathing or heartbeat.
Well, that's kind of what I was getting at, and I'm very curious about it. But like they say, you hear people say that like this couch it takes the form of a couch because on a nuclear, or I guess the smallest particles or whatever are basically vibrating that kind of created this shape. And I'm not a scientist or a doctor or anything like that, but it feels to me like there's something to that, like that maybe my cells and the things that make my body what it is are kind of at a certain energy level. And the reason why I connect with some people is just because we're vibrating at the same kind of deal, or maybe opposites. Maybe we complement each other in some ways, like a chorus.
I certainly agree with the experience of that. I don't necessarily attribute the same physical reality to it in terms of, but certainly we've all experienced that. Well, and like I said, I'm not very extroverted, but met my friend in a bar, like randomly, and we just had sufficient resonance that it grew into a friendship out of a very chance meeting, compared to my other best friend who, we spent 3 years in residency together, working together 80 plus hours. Okay. You can understand how a friendship grows there. Right. And we have a lot of resonance as well. So that friendship lasted after residency, whereas other people I spent the same amount of time with don't talk to and don't particularly care to talk to.
Right.
So yeah, I think that's kind of another manifestation of it. It's after the period of stress is over. Are you going to keep calling this person? Are you going to keep talking to this person? Are they still going to be important to you in some way?
Yeah, I mean, that kind of stuff because the explanations of like, how does that happen? Why does that happen? You know, I mean, no one's ever going to know the answer, but I do think about that. You know, why did this person why did I stay connected to this person? Or why does this person choose to continue to reach out to me, even if I don't think about them that much?
Sure.
You know,
I do think in some ways, part of what stands out to us in the universe is the things that are, so I'm actually also in the process of writing a book.
Are you?
Yeah, it's a somewhat underground project, but
awesome. Okay, I won't have you leak any details.
No. I'm totally happy to. It's mostly underground because I haven't quite figured out certain sections, which we can also talk about. It's kind of entertaining, but it dives a little bit into kind of like Jungian psychology. And one of the ideas that Jung had is that the process of maturing was becoming an individual, or becoming, he called it individuating.
Yes.
So becoming your sort of ideal self, actually kind of going
Sure.
back even to what we were talking about before. And so in that process, certain things would stand out to you in the universe as being important. Your unconscious would recognize those things as being important in the process of becoming yourself. So, hey, your ideal self is someone who is a physician. Okay, let's say, right? So when I came across some idea of treating people, that instantly had that resonance because my unconscious already knew that helping people was going to be an important part of becoming my ideal self, right? And so maybe other people, I think, are the same thing, is when you say, hey, this person is going to push me towards being my ideal self, or something, I have something to learn from this individual, and your unconscious just recognizes.
That makes a lot of sense. Yeah. I like that. I'm gonna think on that more.
Just an idea, but just what bubbled up.
Well, what are you comfortable telling me about your book?
So the book is an exploration of a number of ideas that I've kind of played around with, or it started out actually as I was talking with an ex, and we were talking about certain aspects of relationships, and kind of wondering like, hey, where do the motivations for those things come? Like, where do those build out? Like, they don't seem to be necessarily related to childhood, or I can't point to anything in childhood that necessarily builds at that. And so I had written over years, I put thoughts together, put them on paper, and then forget about them. And I kind of pulled out one of those articles and was like, well, I wrote something about this like 20 years ago or whatever, or I was in college. And she was like, do you have other stuff like this? And I was like, yeah, I have all this stuff. And she was like, well, you should put it together in a book. So I thought, sure, I'll throw a bunch of articles together, call it a book, throw it on Kindle and whatever.
Yeah.
But then I was like, well, I need to kind of edit a little bit. So I started editing, and then, and it's all relationship related, right? And then it was like, well, there's some deeper themes here. What are those deeper themes? And some of the deeper themes, the big parts of the deeper themes are, number one, embrace, something Jung talked a lot about, embracing your shadow. So the parts of yourself that are angry and lustful and greedy and cruel, those things we hide in our public persona because in order to socialize, and we should hide those.
Sure.
We need
There's
to
some
hide
utility
those.
to that.
Yeah. But you can't actually embrace yourself as a full individual until you see those things fully in yourself.
Yeah.
So the other thing Jung talked about is that seeing could not be intellectual. It had to be an embodied seeing. So you had to live your greed and live your lust and live your anger and inhabit it. And then the question is, how do you do those things safely? Because you can't do them publicly. Right. And I think one of the major ways we do that is in intimate relationships.
Yeah.
And sense. Specifically in this, maybe the safest way we do that in intimate relationships is through play. Mm-hmm. And the idea of playing with someone that you are truly intimate with, and that can be sexual play, that can be non-sexual play, that can be whatever, but it's the kind of play that as adults we forget about. It's so kids play this way. Is no, you can't be the Red Power Ranger because I'm the Red Power Ranger, and there can't be two Red Power Rangers, of course, because that's not how it works.
Right.
And there's anger and tears associated with that because it's real.
Right.
And it's not that they're not hallucinating. They're not insane, but it is real play.
Yeah.
Right.
Yeah.
And that form of intimate play, I think is the key to safely inhabiting some of, I think we get that a little bit, guys get that a little bit through competitive sports,
Sure.
some of the anger, aggression sides of it. The parts that guys don't get is some of the more hedonistic, self-indulgent sides, unless there's alcoholism or other addictions or whatever that are negative. But
right.
Women, I think, are taught better to appreciate fine wine or, great smells or a candlelit bath or whatever. There's an encouragement there
Sure.
socially. And so, and so Jung conceived of this in terms of archetypes. I think it was Moore who wrote about the 4 male main archetypes, which is the king, magician, warrior, and lover. And each of those has a shadow. The shadow of the king is the tyrant and the weakling.
Right.
Right. The shadow of the magician is the manipulator and the naive sort of one who is taken advantage of. And until you inhabit the shadows and really recognize, there's parts of me, especially in a relationship, that would love to just be an absolute tyrant.
Right.
And just, bigger, stronger, and scarier than you, and you're going to do it my way.
Sure.
And unless you really own that and actually own it in a way that's not intellectual, again, you live it in some way. I think, I think, not to be graphic, but I think that's where like the appeal of rough sex comes from in some ways, is inhabiting that warrior aggression, the negative side, the shadow side of it, but doing it in a way that is within the framework of play, but it's serious play.
Yeah, it's self-discovery.
Yeah.
I think you're not going to really fully know yourself and know what, know your potential and what you're capable of on both sides. Like sometimes you need to know the ugly sides of what you're capable of so that you can learn how to harness that or keep it at bay or control it or whatever your goal is,
So that's a large section of the book. The other section of the book is then negotiating consent and figuring out, and I think one of the issues I see in our public discussion of consent is it's primarily framed at the idea of consent in almost a college campus kind of way, which is fine and valuable maybe for young people growing up. But, if in a long-term marriage relationship, consent has to function differently.
Right. Right. It's different. Yeah, it's very different.
You're going to get explicit verbal consent for every kiss.
Right.
Can I hold your hand? At some point, like these consents are assumed and whatever, but then others aren't. And figuring that out, I think, is tricky. And then negotiating. So then the other key I found. So in my marriage before we got divorced, and many people struggle with this. There was a mismatch in libidos. Mm-hmm. Right.
Yeah.
So how do you negotiate that? How do you figure that out? If you just say, well, the high libido person gets their way all the time, well, then basically the lower libido person is getting raped fundamentally. Right. A certain percentage of the time.
Yes.
Right. If the lower libido person only gets their way, well, then at what point are you breaking the marriage contract and saying, hey, I'm going to make sure, because I expect you to be sexually exclusive, but now I'm also not allowing you the sexual outlet you want.
Right. Yeah.
So at what point is that a break of the marriage contract? So negotiating those kinds of things, I think, becomes very tricky, and figuring out how to. So it's an exploration. It's more questions than answers, but I think there's a detailed kind of exploration
and it just
of
goes
those
back
issues.
to that whole thing about being okay, being vulnerable with somebody, asking for what you want, and also being open to their side of it that may be counter and different to what you want, and that's where that intimacy really comes from in all relationships.
And one of the concepts I also flesh out, and this was kind of, again, a lot of this came out of my own relationship, so kind of analyzing what went wrong and so on and so forth. But Betty Martin has a concept that older psychologist, relationship therapist kind of lady, she talks about called the wheel of consent. On the x-axis, she has the idea of who is benefiting from this interaction. So if I offer my partner a massage, she could be benefiting. It's for her. Or I could be benefiting because I get to feel her up, right? And so being a little bit honest about where the benefit lies is part of it. And then the other aspect is who is doing the action, right? So I'm doing the massage, she is receiving the massage.
Right.
And so the idea of giving a gift, let me give you a massage as a gift, as a favor, right? And you receive that gratefully and kind of feel taken care of and whatever. That hinges on the idea that the massage is for your benefit and I'm the one doing the action, right? But if secretly the massage is for my benefit and this is just the only way I can get you to let me feel you up, right? That dishonesty in motivation poisons that interaction.
Totally.
And so she talks about the integrity of being willing to sort of be honest about your motivations. I think the third axis that she doesn't talk about that I kind of add on is the idea of initiating, is who brings up the massage.
Right. Okay.
Does she bring it up and ask for it because that's what she wants? That's one aspect. Or do I notice she's tired and I bring it up? Right. And the challenge there is that initiative energy is part of what leads to burnout in relationships. If one person is constantly initiating both the things, I'm going to advocate for the things I want, and I'm going to advocate for the things that you need. Well, now that's where that burnout happens because I'm putting all the energy in to do both sides of the equation.
Yeah.
Right.
And I've seen that and experienced that lots of times.
Yep.
You know, that makes a lot of sense.
And so framing that, I frame it in terms of roles. So like if you're a caretaker role, right, then you're the one who's initiating the action. You're the one who's doing the action, but it's for your partner's benefit, right? And they're the caretakee where they're receiving your initiation, they're receiving your action, and it's for their benefit, right? And then you can have another interaction that's kind of like a coach, and I call it like the star quarterback, right? So that kind of interaction where I am initiating, but I'm initiating you to act for your own benefit. And you're receiving my initiation, you're receiving my motivation, right? But you're doing the action and you're receiving the benefit, right? And you're the kind of star quarterback kind of role, right? And so those kind of complementary roles that we play with each other, we just have to make sure that they're balanced. And I think that's kind of analyzing, hey, I'm kind of playing the cheerleader here a little bit too much. I think you need to take some responsibility for your own actions and generating the motivation there. Yeah,
and then having the courage to say exactly that.
Yep.
Yeah,
and half of it's courage, and then half of it's articulation. It's hard to figure these things out, you know?
Right.
I mean,
well, that's what I was just thinking. Is like I've never spent any time thinking about those three dynamic pieces of it, you know, or at all. You know, I maybe have like maybe some piece of it under, you know, but I've never thought about it in that way, you know.
Yeah.
So
and being able to put labels and kind of have a structure of understanding allows conversation to proceed in a way that's not blaming or, you know, whatever. This is how I perceive it. And that's the other interesting thing is that, you know, wires can get crossed when miscommunication happens, and hey, I thought I was doing this for you. And she's like, no, I thought you wanted to feel me up. I thought I was doing it for you. I didn't even want a massage. Right. And so, okay, we both made assumptions here. And then I ended up getting tired and burnt out because I had a long day, but I offered you a massage because I thought it would be good for you. It's not what you wanted in the first place. And now all that energy is wasted.
Yeah. And this happens all the time, and oftentimes unknowingly, you know, we're not even awake enough to be aware of that.
Sure.
You know,
I think the one that comes up for me a lot, you know, is, you know, exes have been like, well, you know, I did this for you. And I was like, yeah, but like, I didn't want that done.
That wasn't for me.
Like, it wasn't for me. Like, you like the house cleaner than I do.
Right.
Like, so yeah, you cleaned the house, but I was okay with it messy. Yeah, I didn't care. Right. Like, you cleaned it for you. Right. Which is fine.
Right. I'm good with that.
Yeah. But and it's not like I had zero benefit. Like, it was nice, but not something I would advocate for myself. Right. Now, if you had cooked me a meal, that would have like really hit me in the feels. Right. Because that's my love language, or that's whatever, like that's what I wanted. Right. And so being able to, again, be honest, be open kind of, and say like, hey, I think you need to own that as much as you're trying to frame that as being for me right now, it was actually kind of for you.
Right.
And that's great, but you kind of need to own that. Right?
Yeah. Just, and that's where people get hung up, is they can't see their own shit a lot of the times, you know. It's like people can't.
Yeah, I think it can be hard. I certainly we all I struggle with it too.
Of course. Yeah.
But that's the other value of an intimate relationship. I think, just thinking about my two best friends here in Austin, like, you know, they call me on my shit all the time. Like, you know, it's like, and I know there's love there. I know there's like, hey, like, you're kind of being an asshole, so stop. Like, you know, whatever. And
You're doing it again.
Yeah. And you can take it because you know that, oh yeah, okay, like I may disagree or I may not, but regardless, I don't feel like I'm attacked. I feel like we can honestly explore whether I'm being an asshole or
Right.
not.
Right. And there's certain people you're willing to just like hear what they're saying, absorb it, and not get it because you know it's coming from love. You don't feel attacked by it because you know them. You know.
I think that's a large part of it. I think the bigger growth and one of the best compliments my friends gave me is he told me, he was like, you kind of just do that all the time. Like even strangers, if they come up and you're like, hey, you're kind of being an asshole. You're like, I wonder if that's true.
Yeah.
Like, am I being in what way? Tell me more. Tell me more about that. Like, let's explore that idea intellectually. Right. And I think that can grow from intimate relationships. You get the practice in the safe zone.
Sure.
But then you realize maybe it's not such a big deal if somebody tells me maybe I am being an asshole in a way I didn't learn, and I can learn to be better. And that's just a good thing.
Yeah.
So why would I even get upset about that?
Yeah. Well, and then there's the other whole thing about, how people see us is they're not actually seeing us. If someone says you're an asshole,
yeah,
it's more of a reflection. It's just a mirror of they're just seeing some part of themselves that's triggering them. So then there's no reason to even take it personally. So sure, let's explore that.
Sure.
Tell me more about it.
It could be, right? But then and if we realize that, if we come to that conclusion, if we have a conversation and we come to that conclusion that you were just reflecting something, great, then you learn something.
Yeah.
Yeah, okay. It's still all for
Perfect.
the good.
Yeah.
Right?
We're all better for it.
Yeah, we're all better for it. And so why not just explore and just say, and there is a reason. I think that's the other thing. I shouldn't be dismissive of that. And that's something that also bothers me. The reason we don't is I think that as social creatures, we do need a sense of status. And I think status gets a negative rep. I think we need to feel comfortable that we are perceived as high worth individuals in society, right? And so that, looping back around to the question you asked before, I think that is something that I've gotten out of those close friendships, is because I know that I really respect both. I think they are both incredible individuals. And because they hold me in high esteem, I can then go out into the world and my status is assured.
Right.
I'm comfortable with my status with them, and I don't need status then from...
It's your home base of sorts.
Yep.
Yeah, that makes sense.
And that close, intimate relationship, I can imagine a really good relationship might provide that as well, to where then you're able to explore and say, well, tell me more about whether I'm being an asshole or not, because my status isn't threatened, because my status is guaranteed.
Yeah, you can crash and burn in somewhat with a safety net. Yep. You can go out there and try some things, and if you fail with certain people, you've always got these unshakable relationships.
Yep.
Yeah. No, that makes good sense. Was there anything that you thought that I was going to ask you about, or that you thought we were going to talk about that we didn't before we wrap it up?
The 3D printer.
Yeah. We actually
just got a 3D printer in the office. It's just, you can build IV pumps with it and just kind of other cool stuff. And so it's part of the innovation of the practice, just trying to see where we can take things.
Yeah. You were talking about that, which is also super, super cool to even have. Like, to me, that the whole thing I was telling you earlier just like blows my mind to like even have. Yeah. I mean, I've heard of 3D printers, but then in my mind, that was like for other people. That was like this is for something that someone else way more intelligent than me would know how to use. But you have the courage and intellect to be like, no, I'm going to figure this out and I'm going to actually do it.
Yeah, I mean, a lot of it is that kind of generative, creative kind of side, right? Is like, hey, let's see what we can make. Let's see. Yeah. Who knows, right? There is a financial investment to get started to some degree. Like it's a chunk of change to drop down on something that I don't know how to use.
Sure.
Like, it's like, okay, I'll figure it out.
Nice furniture right now.
Yeah, exactly. But I think the exciting thing is in the biggest of pictures, I think we're seeing, and now we're getting a little philosophical again, but we're seeing a democratization of creation. So like if you wanted to manufacture something, 20 years ago,
yeah,
you can have a great idea, but prototyping it, getting it built, playing around with it, having it in your hands to say, no, that's not the right size. No, that's not, whatever. Right. That's hard to do. I mean, you can carve it out of wood, I guess.
Yeah.
Right. But, it's really hard to do that. This allows you to prototype, plan, create, build, and then maybe you make something amazing, and then maybe you offer it to the world, and you can say, hey guys, here's this thing I made, and now I've got a mold, and I can injection mold 10,000 of them and sell them or whatever. But the prototyping and stuff that is allowed here, or I just need one of something.
Just like a one-off thing.
Yeah.
And to a specific spec.
Yep.
And this, you can just make it right here.
Yeah. And it'll just make my life a little better or a lot better or whatever. And there's everything and to me, it's also like removing the stupid irritations of life. So like there's a great little 3D print for something that slips over a doorknob so that when it goes and bumps up against the wall, it just, it springs so it doesn't dent into the wall.
Right.
Okay. Is it life-changing? No, but
kind of handy.
Yeah. I don't have to drywall before I sell the house, right? Now.
So does this thing come with like a template of a bunch of different things that you could make? Like, does it come with?
It came with one, that vase you see behind you. That's it.
What exactly is that? What material is
plastic.
It? It's plastic.
Yeah. So it basically comes in that, you see that spool behind you? So it comes in that filament. It's a thin thread of plastic, and it goes through a motor, and the tip of it is heated, so it melts the plastic, and then it just moves around and sort of deposits layer after layer of melted plastic that kind of cools and congeals into a shape.
And obviously, based on what I'm seeing here, there's a certain size thing that you're limited to.
Yeah, I mean, you're limited to the size of the enclosure, right?
Right.
So theoretically, you could build bigger and bigger enclosures, and in fact, they're 3D printing houses.
That's what I was just going to say.
Yeah.
I heard somebody was 3D printing homes.
Yeah.
How the fuck do they do that?
I mean, you just make it crane size, right? I don't know if you can, if you look inside, right, it's just a track. So, that it just moves, right? But you could easily make a crane instead of this, and it would just kind of, the crane would move in 3D space and just deposit layer after layer of concrete or whatever. Yeah. I don't know. I again, just getting to the bigger picture of the philosophy, like, you think about things like Bitcoin, right, that are democratizing money. And this is democratizing manufacturing. Yeah. And so it's this idea of, like, we were talking about the COVID vaccine with my buddy Atif, like way back when. And, just sci-fi type stuff starts to become possible. Is like, well, what if every doctor's office, because the RNA of the vaccine was synthesized in like 9 days. Right. We knew how to do that. Yeah. Right. So what if they just published the RNA sequence, and we had an RNA sequencer here in the office, and we could just make vaccine doses on demand. Just print them. Easy. Just 3D print them, right? And that kind of world may not be too far away.
We've got to be close to that.
Yeah.
At this point, I mean,
and then how far do you take that? Are we democratizing pharmaceuticals? So that's a pharmaceutical to some degree, right? Yeah. But could we have, you have we buy a chemical maker, right? And you say, oh, my doctor's prescribed me whatever. And you just type it in, and it prints, quote unquote, 30 pills of whatever that is, I don't know. Weird things are possible. And so,
yeah, it's so, it's just like it makes my brain hurt just thinking about it, because then it's like, is that safe? You start thinking, is that safe? Like, is it,
I mean, not at first. No, I mean, you wouldn't want to, whatever.
Because did I hear that somebody 3D printed an organ, a heart or a liver or a kidney or something?
They've been trying to 3D print, I don't know the details of how they did it, but they've 3D printed hearts and heart valves, knees, so joint repair. Yeah. You can get, because, the standard knee replacer is just a standard size, right? So you could spec it out to your body, and again, one of those one-offs, right? Is that like, well, it's very individual, but we can make individual parts now. So that's kind of a cool.
It's amazing. Just mind blowing. Well, thank you for introducing me to that. Thank you for spending your time. I had an awesome time just kind of learning from you, and just
always a pleasure.
Yeah. Well, it didn't come without our technical hiccups, but we powered through. So
that's right. That's part of what it's all about, right?
Well, I'm looking forward to sharing you with our community, and awesome. Thanks for your time, man.
Yeah. Thank you.
Yeah, take care.